All right. My name is Dylan Hoffman. I'm a first-year student in the Indiana State University DAT program. With me today is Micah Ramos. Micah, you want to go ahead and tell us a little bit about yourself?
Yeah. Hey, Dylan. Thanks for interviewing me today. Like Dylan said, my name is Micah Ramos. I'm a athletic trainer. This is my third year out of undergrad. I just finished 2 years in a graduate assistant position um, at a Division II university. So currently working on getting my first real job, but this is my third year out in the real professional sense, and just currently living in Bernie outside of San Antonio, and just got married. So it's been nice. It's been a nice change up to my life in the last couple months.
Congrats.
Thanks, man. I appreciate it.
So Micah, what we're talking about today is evidence-based practice, and I just have a couple of questions about evidence-based practice. The first one is kind of how would you define it?
I think evidence-based practice is honestly a good thing for athletic trainers, but the way I would define evidence-based practice would just be it's tools or techniques or research that people with higher degrees than me have gone over, and they studied it, and what they do is they implement these techniques that work, then that are proven in their clinic in order to get the best patient-oriented outcomes. Honestly, it's constantly evolving, but the fact that we've implemented it kind of puts us up there with the physical therapists and other professions that are growing around us. So I think evidence-based practice is a good thing. Still somewhat of an anomaly for a lot of people, but it's growing.
Awesome, thank you. So when were you first kind of exposed to the idea of evidence-based practice?
I think I was it kind of hit me when I first learned about it. It would definitely be an undergrad. Obviously they talk about it in our curriculum and kind of give us some insight on it. Now, am I a practitioner or a researcher? No, but I would definitely say an undergrad is where I was exposed to it and where I was informed about it and shown how to go through the proper channels on how to use evidence-based practice.
Awesome. So do you have any examples of, I know you mentioned finishing up a grad assistant position recently. Do you have any examples of kind of in your clinical settings of ways you've implemented EBP into your own practice?
Sure. I think the head athletic trainer that I just worked with, he's pretty big on evidence-based practice research. We don't want to be wasting anybody's time or our time on techniques that don't work or that aren't proven or researched. So we did spend time, we go share articles with each other, send each other links, and study things that have been researched so that we can implement in our practice and get the best oriented outcomes. Obviously, it takes time, and you got to be able to set that time aside to study the research and to implement it after that. But I think it's beneficial, and as long as you have goals for the patients and the patients understand what you're trying to get from them, I think it works well.
Awesome, thank you. I guess the last question I have for you is when you're implementing this evidence-based practice, do you run into any challenges, or what's been your biggest challenge as far as implementing some of these techniques?
I think that's a good question, Dylan. I think in my experience with evidence-based practice, the hardest or the biggest challenge that we face is sometimes there's a little confusion about how specifically the research was done or how the clinicians in the research implemented. And some people are very clear about their techniques and methods, but some people aren't. And that leaves a little gray area for us as the practitioner who are studying the research, because we don't know exactly what they were doing at a certain time period or when certain things were done in order to get the most effective results. So it's just sometimes when the research is a little unclear, that kind of leaves the practitioner a little in the dark about it. But I think people are getting better at showing every method in order to make it as streamlined as possible. It's just there's some research out there still that maybe it's a little older research, but it's a little more complicated to interpret and use. So that's probably what I would say the hardest challenge is.
Okay, awesome. Well, thank you for your responses, and thank you for coming on and talking with us today.
Yeah, thank you guys. I appreciate it.
All right, take care.
Take care, man.